Congratulations on your new baby. She's so
Thank
cute. We're going to do some discharge teaching so we can get you guys home. So first it's going to be on your diet. So adequate nutrition is good for your body to heal. So you should eat foods that are high in fiber, which include bran, broccoli, cauliflower, and fruits to help your bowel movements become regular. You also want to eat foods that are rich in calcium, which include dark green leafy vegetables, milk, and yogurt. Drink plenty of water and non-sugar supplemented juices each day to satisfy your thirst and maintain hydration. Avoid soft drinks, coffee, tea, and alcoholic beverages. For your activity, you want to gradually increase your daily activities until you're back to your normal routine. Rest frequently. No lifting, pushing, or pulling for the first 2 to 6 weeks or as instructed by your physician. And do not drive until you're released by your physician. So breast care. Your breasts and nipples may have changed and are grown in size during your pregnancy. So you want to wear a well-fitted supportive bra day and night, which may be more comfortable as your body adjusts to these changes. You want to wear breast pads until your breasts stop leaking. Leaking may occur for several weeks to months, and you may apply ice packs between feedings to ease discomfort. So if you're not breastfeeding, you want to wear a well-fitted supportive bra for at least 3 to 4 days following delivery. You want to refrain from stimulating the breasts and nipples. Do not pump breast milk or permit the newborn to suckle to alleviate engorgement. Apply cold compresses in the form of a frozen wet towel, cold packs, or ice packs for the first 15 minutes at a time every hour as needed. To prevent tissue injury, do not apply cold directly to the bare skin. Do not massage or apply heat to the breasts. Now, if you are breastfeeding, your baby's mouth should form a tight seal. The lip should be against your areola, not the nipple. If the baby is sucking incorrectly, slide a finger between your baby's lips and your breast to break the suction gently. Reposition and try again. How long should your baby nurse? As long as it wants, which is usually 10 to 30 minutes. At first, your newborn will probably want to nurse many times in a 24-hour period, though not for very long. It's important for the health of your breast to have your infant feed from both breasts every feeding. Good signs of nursing are hearing your baby swallow without a clicking sound, seeing movement above the baby's ears, which can look like a wiggle, and not seeing dimples in your baby's cheeks. You and the baby should appear calm and relaxed during the feeding. You should feel gentle tugging at the nipple, but no pain after the first few minutes. If you do feel pain, it may mean that the baby is not positioned properly, or that the tongue does not extend past the lower jaw. So remove the baby and begin again. So for hygiene, wash your hands frequently as you're caring for yourself. To prevent infection, always wipe front to back after going to the toilet and clean your bottom with warm tap water using a Perry bottle after you urinate or have a bowel movement. It is important you change your pad frequently. Your vaginal flow will decrease in an amount from bright to red to pinkish or brown to a yellow or cream color. Your menstrual period may occur as early as 6 weeks to 2 months after the birth of your baby. For your bowel movements, you want to avoid constipation, so you may take a mild laxative or stool softener until your bowel movements have returned to your normal pattern, and increase fluid and fiber in your diet. You want to discuss birth control options with your healthcare provider. You may choose to obtain a method of birth control before receiving sexual intercourse. And then for sexual activity, nothing should go into the vagina the first 6 weeks after discharge. Sexual intercourse should be avoided until bleeding has stopped and the woman feels physically and emotionally ready. So some warning signs to report to your healthcare provider immediately are pain, redness, warmth, swelling, drainage, or foul-smelling discharge from the incision, or the incision begins to open. Discharge from the vagina that has a bad odor, severe headache or blurred vision or visual changes, temperature over 100.4, or if you feel cold, feverish, and have chills, thoughts of harming yourself or your baby, pain or burning sensation, redness, warmth, or swelling in the legs, breasts that are painful, swollen, hot, tight, itchy, or have sore spots with redness or red streaks and flu-like symptoms, sharp pains in your abdomen, breast, or chest, trouble breathing, dizziness or faintness, crying spells or mood swings that feel out of control, unable to empty your bladder, or urination that is painful, difficult, or too frequent, and difficulty having a bowel movement. And then to report any domestic violence or abuse, call 1-800-96-ABUSE. So for your baby, some safety for your baby. baby. So for sleeping, place your infant on her back to sleep. Use sleep clothing such as a one-piece sleeper instead of a blanket. Do not let anyone smoke around your infant. Use a firm mattress and a safety-approved crib covered by a fitted sheet. Car seats and other sitting devices are not recommended for routine sleep. Do not use pillows, blankets, or pillow-like bumpers in your infant's sleep area. Wedges and positioners should not be used. Keep soft objects, stuffed toys, and loose bedding out of your infant's sleep area. The baby should sleep in the same room as the parents, but not in the same bed. Avoid covering the infant's head or overheating. A bulb syringe, you want to keep the bulb syringe near the infant at all times to clear the infant's throat or nose as necessary. Clean the bulb syringe well with warm soapy water after each use and allow it to air dry. Wash your hands prior to handling the neonate. All infants are required by law to use a car seat while the car is in motion. Children should be placed in a child safety seat according to state laws. The use of outdoor announcements is not recommended to announce the birth because they call attention to the presence of a new infant at home. So question any unfamiliar person visiting your home or inquiring about your baby after discharge. Do not use home monitors or commercial devices marketed to reduce the risk of SIDS. So some normal behavior for your baby is to cry. It's a normal response for your infant to cry. The most likely causes for crying are hunger, need for a diaper change, or needing to burp. You should burp your baby after each feed. Calming techniques include feeding your infant, changing the diaper, gently rubbing the back or tummy, walking with your infant, rocking your infant, skin-to-skin contact, or giving your baby a pacifier. It is never okay to shake your baby. If you get frustrated or angry, put your baby in a safe place, take a break, and call a friend. Infants require a lot of sleep. You should be waking your baby at least every 3 to 4 hours for feeding. You should place your baby on her tummy each day for supervised tummy time. This will strengthen her neck and abdomen. So if you're breastfeeding your baby, your infant should be breastfed 8 to 10 times a day per infant cues. For positioning, be sure to hold your infant close to you while feeding. Your infant needs to be cuddled and skin-to-skin time is recommended. After feeding, hold your infant upright over your shoulder while gently patting or rubbing her back to burp. If you're formula feeding, your neonate is going to receive a Similac or Enfamil diet. If your baby sleeps longer than 4 to 5 hours and misses feeding, awaken your baby to feed. Your infant will generally take 2 to 3 ounces per feeding after the first few days of life and will need to eat every 3 to 4 hours. For positioning, be sure to hold your infant close to you while feeding. Your infant needs to be cuddled. Never prop your infant's bottle to feed. Infants need to be burped every half ounce of formula. After feeding, hold your baby upright over your shoulder while gently patting or rubbing her back to burp. So some newborn characteristics is a newborn rash. It's normal for your infant to develop a rash on her skin. It appears with small red circular areas with a white dot in the middle. This does not require treatment and will generally resolve within the first few weeks of life. Avoid lotions, powders, and perfume soaps. Milia are pearly white bumps, usually on the face, especially the nose. They will disappear within the first week of life. Jaundice is a common occurrence in newborns. Your infant may appear to have a yellow coloring to her skin. It will start in the face and progress down to the toes. If your infant appears more yellow in the next 24 hours, you need to call your healthcare provider immediately. So for infant care, your infant will need to be sponge bathed until the umbilical cord falls off. Using a soft washcloth and plain water, gently wash your infant's face. Bathe your infant from head to toe, saving the diaper area for last. Mild infant type soap may be used on your infant's body. And then cord care, keep the umbilical cord clean and dry, cleanse with warm water and soap when soiled. Inspect the cord and surrounding skin with diaper changes and notify the pediatrician if drainage or discoloration is noted. The umbilical cord will generally fall off within 2 weeks of life. And then wet and dirty diapers, 1 to 2 wet diapers are normal for the first day or 2 of life. Then you should expect to have 6 to 8 wet diapers of pale urine every day. Over the next few days, your infant's bowel movements will begin to change from a yellow-green to a mustard yellow and will soften in consistency. Your infant should have at least 1 bowel movement every 24 hours. You may want to keep a record of your infant's wet and dirty diapers to monitor adequate elimination and hydration. So for the genitalia, for a female, always wipe baby from front to back. Be sure to cleanse all creases and folds to prevent diaper rash. Pat drying diaper. It is normal for baby girls to have a white or pinkish discharge. The secretions are normal and will gradually disappear. For an uncircumcised male, always wipe the baby front to back. Be sure to cleanse all creases and folds to prevent diaper rash, and pat drying diaper. For males that are circumcised, always wipe the baby from front to back. Be sure to cleanse all creases and folds to prevent diaper rash, pat drying diaper. Vaseline gauze is applied to the circumcision with every diaper change for approximately 24 hours. The head of the penis will appear red initially and then will change to have a yellowish sticky film. This is very normal. If you see any bright red bleeding or green drainage, you should contact your healthcare provider. The plastic ring method of circumcision does not require a dressing. The ring that is used will come off usually by 2 weeks. If you notice swelling, bright red bleeding, or green drainage, you should contact your healthcare provider. To cleanse the area, wipe gently with a soft cloth, cotton swab, or a gauze pad in plain water. For dressing, you want to dress your infant as you would yourself. So avoid overdressing your infant. Too much clothing and too many blankets may cause your baby to become overheated. And the vaccines, all infants should receive all their recommended vaccinations. And that's it.